talking about hypertension, which some people know as high blood pressure. So if you're training a client with high blood pressure, there's some points that you should be aware of. Usually, without a doubt, prior to any training, you should be taking their blood pressure before and after a session, just to sort of get a base idea of what their blood pressure is. During strength training, if you do take on a little bit of strength training, always ensure that they're only lifting about 40% of their maximum weight. It's about slow reps, technique. We don't want high intensity reps, and we certainly don't want them lifting too heavy, okay? The blood pressure can rise, thus causing issues even as far as to say as a heart attack. Also, when training a client with high blood pressure, make sure if they're going to go down and do any sort of crunches or lay in a horizontal position, their chest is slightly elevated. Another point to also remember is making sure that if they are doing different forms of exercise through strength training, that they're not coming up really quickly, because as that blood pressure is rising, we don't want to get it too high with their strength training. If they come up too quickly, they can have dizzy spells as well. So always ensure at the end of any strength training with someone with high blood pressure, you always watch them come up and make sure they're not getting dizzy. Another point to also remember when you're training someone is make sure when they're training, you're watching their breathing as well. It's similar to us, where you want to make sure that they're not overexerting themselves and holding their breath. If they're holding their breath, then the blood pressure is going to rise, and then they're just going to let it go and it's going to drop. Hence, then you can have some issues with dizzy spells as well. So it is very important to make sure that their breathing is in a good rhythm and they're not holding it. But the most important thing to remember is if they're going to do strength training, which is all part of a really good health program for someone with high blood pressure, which obviously can reduce the chance of kidney failure, heart disease, diabetes, all those different medical conditions, is to ensure that they are not lifting more than around the 40% of their maximum weight. It's not high amounts of weight, it's about a nice controlled weight and easy reps. We don't want fast, and we also don't want too heavy with the reps. Thank you.